Hello, my name is Bonnie Dobbs. I first became interested in Medicare about 10 years ago when a family member developed Alzheimer's, and I found myself daily in nursing home and memory care, going to visit them. I saw firsthand just how confusing that Medicare was. Today, I'm going to go over Medicare basics, and I'm glad you're here, and let's get started. We'll dive right in. Again, my name is Bonnie Dobbs. I have taught my team, and they can help you. Our phone number here is 770-373-7541. There's never a fee for our services. I would love to speak to your group, church, organization, or the media. Please know we're not affiliated with the U.S. government or federal or state Medicare plan. The resource of this presentation is Medicare and You 2021. You can get it by going to medicare.gov and downloading it. Today we're going to look at Medicare, but we're going to start off with COVID-19. Understanding Medicare is confusing, but today we're starting with COVID-19 because it's what is on everybody's mind at the moment. Are you an at-risk person, or do you consider yourself an at-risk person? Some of the suggested guidelines for at-risk is protect yourself and others by wearing a mask. Keep your distance 6 feet, avoid touching in crowds, wash your hands for 20 seconds with soap and water. Now, notice this says if you are considered at risk, because everybody is not considered at risk. I know that wearing masks is a very controversial topic at the moment, but sometimes you have to be your own best mommy. So take care of yourself first if you consider yourself an at-risk individual. Now, in the beginning, whenever the pandemic first started, the Medicare and the insurance companies were going back and forth about what they would and would not cover. So as of today, Medicare is covering the lab test and antibody test for COVID. Original Medicare and Advantage plans cover all medically necessary hospitalizations and quarantine, but you still pay deductibles, co-pays, and co-insurance. So please keep that in mind. And once again, if you have a Medicare Advantage plan, you have the access to these same benefits. So telehealth has become extremely popular because it's a visit where you use audio or video without actually going to the doctor's office. In the beginning, you had to have audio and video. However, they understood that many people could not use this technology or didn't have access to this technology, so they have changed it. So now, if you only have audio, which is a phone, you can use telehealth. Now, audio is a flip phone, and it's hard to teach old dogs new tricks, but you might want to consider getting a smartphone this year. Telehealth covers certain doctors like your primary care and specialist appointments. Right out of the gate, they realized that people who suffer from mental and behavioral problems really needed to continue to see their doctors, so they included that in telehealth. Most recently, they have added physical, occupational, and speech therapy. So now, instead of risking yourself and others by going into a doctor's office, you can have many telehealth visits at home. I've listed some resources here. If you have original Medicare, you can check with medicare.gov for the latest updates. However, if you have a Medicare Advantage plan, call the 800 number on the back of your Medicare Advantage plan card. I've listed here some numbers if you have substance abuse or mental health. They created a disaster distress hotline. That number is 1-800-985-5990, or if you can text Talk With Us to 66746. For the hearing impaired, you can dial 1-800-846-8517. Do you find Medicare confusing? Have you ever sat down and tried to understand a book, or you get mail and it seems like one piece of mail says one thing and another piece of mail says something else? Or what about calling somebody on the phone, or somebody who calls you on the phone? Do they confuse you more and you're just ready to scream whenever it's all over? I understand that Medicare is confusing, and I hope this seminar will provide information in simple terms. So let's get started. What is Medicare? Medicare is health insurance. Now, you qualify if you're 65 or older, if you're under 65 but have certain disabilities, or if you have end-stage renal disease. You must be a U.S. citizen or legal resident who has lived in the U.S. for at least 5 consecutive years. This is a Medicare card. If you don't have one, this is what it looks like. What is Original Medicare, and what does it cover? Let's talk about the ABCs and Ds of Medicare. Original Medicare is what we're going to talk about first. Original Medicare, if you have a card, you'll see it shows Part A and Part B. So Part A has hospital. Now, know that Part A covers much more than hospital. It also covers nursing home and hospice. So think bed, because Part A pays for you whether you're in the hospital, nursing home, or hospice, and those are times when you are in the bed. Part B is for medical. It takes care of doctors, their services, their supplies. So whether you need a Band-Aid, a stitch, joint replacement, or brain surgery, that's what your Part B pays for. It also pays for much more. It pays for preventative, like your Medicare annual physical, whether you need a flu shot, a test like an MRI, a CAT scan, your therapies, physical therapy, occupational, speech therapy, and also durable medical equipment like oxygen, walkers. So Original Medicare is Part A and Part B. Part C is also known as an Advantage plan. I'll go over that a little bit later in the presentation. Part D stands for drugs. Now that one was easy, wasn't it? Original Medicare. What does Part A cost and how do you get it? What about Part B? So the way you get Part A is by paying into FICA taxes during your working years. So once you've paid for 10 years, which is equivalent to 40 quarters, you have self-funded your Part A. Now, if your spouse worked, their employer took out double, and so yours is paid also. Part B starts when you become Medicare eligible. For 2020, it's $144.60 for most. Notice I put for most on the end. There's varying amounts depending on income. It could be more or less. I'll also address that a little bit later on. Now, just know, if you have Original Medicare, there is no limit or cap to your out-of-pocket cost. Now, that's a scary thing, isn't it? There's 2 ways to get your prescription drug plan. One is you can enroll in a standalone prescription drug plan, or you can join a Medicare Advantage plan that offers the prescription drug plan right in it. Let's go back to original Medicare. Like I said, original Medicare pays 80%. That leaves you owing the Part A and Part B deductibles and that 20%. Well, 20% of X. Well, that all depends. What did you get done? How much was your medical bill? Was it $100, $1,000, $100,000? Since that's a scary place to be, there's two ways to get coverage. One is a Medicare Advantage plan, the other is a Medicare Supplement plan. Let's talk about Medicare Advantage plans. They're offered by private insurance companies. They offer all of the benefits of original Medicare and usually offer additional benefits. The good thing about a Medicare Advantage plan is it has a maximum out of pocket, unlike original Medicare. Now, to qualify, you must be enrolled in both Part A and Part B and live in the service area. Medicare Advantage plans are not supplement plans or Medigap. If enrolled, the Advantage plans replaces original Medicare. They're not secondary payers to Medicare. Medicare Advantage plans offer all of the Medicare covered Part A and B services. Some plans also provide the Part D benefits and additional benefits like dental, gym, vision, and hearing. These are the plans that you see mostly advertised on TV. I always like to say that Medicare Advantage plans provides care for all the headaches caused by trying to understand Parts A, B, and D. Now, remember I said there's two ways to get coverage to offset the cost of original Medicare. The other way is a Medicare Supplement plan, which is also known as Medigap. Medicare Supplement plans help pay that 20% not covered by original Medicare, and some pay the Part A and Part B deductible. Medicare Supplement plans do not include the drug plans, and you must purchase a standalone drug plan in order to have drug coverage. Remember, if you don't have drug coverage, you get a penalty. I wanted to create a little chart here to go over some of the differences in a supplement plan and an Advantage plan, and they're almost like polar opposites. With a supplement plan, there is no network of doctors or hospitals. With an Advantage plan, there is definitely a network of doctors and hospitals. So with the supplement plan, you can go to any provider in the nation that accepts Medicare. With Advantage plans, you use their network of doctors and hospitals. With a Medicare supplement plan, you do have a monthly premium, but then you limit your copays and deductibles. With a Medicare Advantage plan, as a rule, they don't have a monthly premium. Some of them do. If they do, it's usually low. But whenever you use it, you do have copays and deductibles. So with an Advantage plan, if you don't use it, then you don't have any money out of pocket. With the supplement plan, each month you will have a monthly premium, but you will be limited to your out-of-pocket cost when you use it. With a supplement plan, there's no referrals necessary. With an Advantage plan, referrals are necessary with some plans. With a supplement plan, you have guaranteed renewable coverage, so you don't need to do anything in each year. Your plan just rolls over. Medicare Advantage plans, on the other hand, are non-guaranteed renewal coverage. Their plans and networks may change annually. They'll send you in the fall a notice called Annual Notice of Change, and you can compare your current year with what's going to be available next year with your current plan, with an Advantage plan. Who or what is Irma or Liz? No, they're not two new gals in the neighborhood. Extra Help, or LIS, is also known as Low Income Subsidy. Extra Help is a program to help people with limited income and resources pay prescription drugs. So if you're single and your income is less than $18,735, your resource is less than $14,390, or if you're married and your income is less than $25,336, resources less than $28,720, then you qualify for Extra Help or LIS. Now, under resources, your home nor your car are considered. It's just mostly available cash on hand. IRMA stands for Income Related Monthly Adjustment Amount. Boy, that's a mouthful, isn't it? IRMA is a sliding scale table based on filing status, MAGI, and premium year. There's a 2-year look back. So as long as you make under $87,000 or married filing joint and you make under $174,000, your Part B for 2020 will be $144.60. They have not released the cost for Part B for 2021 as of this writing. Part D would also have additional cost, and then once again, that's based on your MAGI and the premium year. How are we doing out there, folks? What is the donut hole? The donut hole is something that should be explained to you at the time when you enroll in your Part D plan. So there's an initial deductible if your plan has one, and those vary according to plan and company. Then you have the initial coverage limit, the donut hole in which you pay 25% for, and the out-of-pocket threshold. Once again, make sure you go over this and have an understanding with your agent whenever you enroll in your plan. Now, prescription drug plans, what you may not know is each prescription drug plans contract with pharmacies. So if you use one of their preferred or mail order, you're going to save yourself money. So if you're already on a plan, call that 800 number on the back of the card today and make sure that you're getting your meds at the lowest cost. How do I avoid a penalty? You must enroll in Part D when you first become Medicare eligible, and don't go more than 63 days or more in a row without a drug plan or credible coverage. Enroll in Part B, as in baby, when you first become Medicare eligible. Now, as long as you enroll on time and do not disenroll, you will not incur a penalty. There are different enrollment periods. Your initial enrollment period when you turn 65 is 7 months, 3 months before, the month of, and 3 months after. Every year during open enrollment, or annual enrollment, it's October the 15th until December the 7th, you have the option to review and compare all new plans for the following year and change plans. Now, special election periods may be a time when you're able to enroll or switch outside of your Medicare initial or open enrollment period. Those times are if you qualify when you retire. If there's a 5-star rated plan in your area, let's skip over to the far right. If you qualify or lose Medicaid eligibility, if you qualify for an S&P plan, also known as a chronic plan, and those two chronic illnesses in the state of Georgia is heart problems or diabetes, or if you qualify for extra help. The two that get most people in trouble is in the middle here. If you move into or out of a nursing home, you qualify for a special enrollment period. I mean, face it, if you're going into a nursing home, it's probably not because you're having a good day, right? But moving out of your plan's service area, even though Medicare is a federal program, it differs state to state and county to county. So that's right. Even if you move to the next county, call a broker and let them review all plans in your new service area. How are we doing out there? You guys learning a lot here? I hope you now have a better understanding of Medicare. Please remember, you can let my team help you. Our phone number again is 770-373-7541. There is never a fee for our services. I would love to speak to your group. And please note, we are not affiliated with the U.S. government, any federal or state Medicare plan. Thank you. I hope this has helped you have a better understanding of Medicare. Have a great day, and we will see you soon.